my name is Emma Shell, and we are going to be talking about the Australian healthcare system.
Hi, and my name is Caroline Hodges. So here on the next slide, you can just see a brief overview of what we're going to be talking about today. So the first thing that we're going to do is just give you a brief overview of the entire Australian healthcare system, talk about how it's funded. Then we'll give you some demographic information about the country, and specifically about some of their mental health services that they offer. Then lastly, we're going to touch on how COVID might have impacted Australia and some of the strengths and weaknesses of the health system as a whole.
So first, we wanted to start out with a brief overview of the entire Australian health system, just to give you a good idea of the health system as a whole before we break it down into demographics and everything like that. So the Australian health system has a mixture of private and public insurance or health. And so that comes in the form of Medicare being the public option that is offered to all Australian citizens, as well as New Zealand and other territories that are considered to be in the Australian government. So every person in those areas is offered that insurance, and it covers certain things, but not all. So for example, it covers medical services, public hospitals, and medicines. However, most citizens choose to have some form of private insurance just to cover things like an extended hospital stay, or for example, orthodontia is not covered, and some other like optical things, so like eyeglasses and things like that isn't covered. So you'd have to have some extra insurance to cover those things, and most citizens do. This system of Medicare was put in place in 1984, and it's been in place ever since then. So there's a couple of really important aspects of Medicare. So that is the Medical Benefit Scheme, or MBS. That's just a list of medical services that the government subsidizes or offers to citizens through Medicare. And the list is kind of monitored by medical experts, and those are government selected medical experts. And it changes periodically, kind of like our insurance would yearly. And then Pharmaceutical Benefit Scheme, or PBS, is kind of the same, but for medicines. So the PBS is a list of medicines, and it gives you their brand name, then a genetic option, and then biosimilar, just based on the cost and what's available. And that helps people keep their medicine costs down. And then that's also medical experts will make that list. However, those are private, not government selected. And then you have safety nets, which is kind of like an out-of-pocket system that we have in our insurances. So the more you spend, the less you're responsible for. So the safety nets say, for example, the threshold is like $500 for the year, then your medical out-of-pocket costs, or what you are expected to pay, would be lower according to the safety net system they have in place. And as mentioned before, most Australians have some form of private insurance cover. That is for things they say are extra services, which maybe not always considered extra in our eyes, but that's things like physical therapy, extended hospital stays, or expanded dental services. And then all of the system works with these primary health networks, and that would be the similarity in our system would be our health departments. So the primary health networks are more based in community care rather than patient-based care. So they're thinking about like preventative medicine in the community and offering those services throughout the community. And then also they're kind of responsible for like emergency medical services and things like that. And then they also provide after hours care and a lot of mental health care as well. A lot of challenges that the Australian government or the Australian health system has, we share. So for example, they have an aging population, so they're needing to kind of change the way that they view care and the services that they offer. They also have higher instances of chronic disease, so they're having to make sure that they can care for those patients, one thing that they are doing is trying to establish teams. So like a health team, if you think of it in like a hospital, if you have a chronic disease, sometimes you'll have a health team making sure that your care is being the best it can be. And they're trying to do that more for chronic disease. So for example, you would have a team of medical professionals working with you all the time to monitor your care. And then also they're trying to improve access for research and development. For example, genomic testing can help people understand what kind of chronic illnesses or diseases that they are susceptible to just based on their genes. But that's really not accessible at the moment. So they're trying to make that more accessible because that would be a very good step in preventative care. Also, health technology, as we've discussed in this course, it's expensive, but it's also extremely precise and efficient. So they're trying to expand access to health technology as well to make sure that those life-saving technologies are available for every patient, not just the ones that have the means. And finally, the health system is trying to use health data more efficiently. So all levels of government kind of contribute to the system. So there's like they share and they have their own specific duties. So for example, the federal Australian government is responsible for the MBS and PBS, so those lists for patients. And then they're responsible for regulating private insurance, which is very interesting just because you would think it would be on its own. And then they're also run the Therapeutic Goods Administration, which is similar to the FDA in that, but it's only for medications, not for food. It manages all of the medications that are available to patients. And then in state and local, they manage the public hospital, preventative care, food safety, and regulation. They also have the EMS. And then both of these levels of government fund the public hospitals, and they respond to national health emergencies. So both of them would have responded to COVID. And then both of them are actively engaged in mental health reform. Now we wanted to go into how the system is funded. We kind of have mentioned this before, but we just wanted to get a little bit more in depth. So funds come from multiple sources, just as in our system. So the government actually pays the bulk of those funds through the Medicare option. Then you have private insurers. Again, many residents have that. Then you have non-government organizations, and then patients paying out-of-pocket costs. So on the right, you can kind of see that breakdown on that pie chart. So the Australian government ends up paying 41%, and then the state and territory governments pay 27%. So the bulk is covered by both levels of government, but individuals are still paying about 17% of the cost, which is quite a lot considering that they have Medicare, which is provided by the government. 10% of the GDP is spent on health, so that roughly translates to out of every $10 spent in Australia, $1 will be allotted to healthcare costs. And the federal government covers most of the costs for medical research, and the state and local government covers community health services. So again, those primary care networks that help the community in a preventative nature and also to provide services in a community. Now we're going to continue into the demographics. So the population age is actually quite similar to the US. A lot of the population is in those two groups, the baby boomers and the millennials. The baby boomer population is the one that is most concerning at the moment. As mentioned before, they have that aging population, that should be the baby boomers. They are quite a large part of the population, and they are requiring services, for example, orthopedic care for joint replacements and things like that. And then also there are slightly fewer Gen X's than millennials. So the millennials are actually the ones that are being trained to actually work in the health field. So that's going to be your workers, which is actually very interesting that they will be caring for this other very large population as they age. And then the population gender is displayed in this chart. Very interesting, but females actually are, it's not a substantial difference, but it's noticeable, especially in Western Australia. So there are 332,000 more women in Australia than men. And especially in the Western Australia area, there are 14,000 more women. And this is really important, especially in those areas that are have more women, that they have excellent women's health services, just because that's the population, that's what they need. So it's good to know things like that to help meet the needs of the population. Next is our rural versus urban distribution for the population, as well as access to clean water. The United Nations Population Division actually provided that the population is divided by 86% urban and 14% rural in Australia. And then according to WHO and UNICEF, the water supply and sanitation hygiene, 100% of the population have access to basic drinking water services. That seems kind of insane to me, but it is 100%. That doesn't mean that they have access to the same, care, but they do have access to clean water. And next is our income and education. So 11 million have certifications outside of school. So that would be like a certification to maybe drive a truck, or to maybe do some form of engineering, electrical work, something like that. And 5,500,000 have bachelor's degrees. The mean weekly household income has actually increased by 0.8% since 2017, and then by 13.2% since 2007-2008. And finally, there are no uninsured citizens because they all have access to Medicare.
Next, we're going to talk about the birth rate and infant mortality. So all of this data is based on the Australian government, specifically the Australian Institute of Health and Welfare. They are a great resource. They post a lot of their own data and a lot of their own statistical information and their journals. So a lot of that you'll see in the presentation moving forward. So in their study from 2019, they found that there was 303,100 babies born within the year of 2019. Of these, there were 51% were male. So they're starting to try and combat maybe that unevenness in the genders in Australia, but still 49% were women. So women are still going to be high up there on the priority in the population. And these were born to 298,600 mothers. And of these mothers, 74 to 75% of them lived in large cities, and 20% of them were actually from some of the poorest areas in the country. So although Australia is one of the safest places in the world to have a baby, or at least that's what their government page says, infant deaths do occur at a rate of 8 babies per day. 6 of these babies are stillborn, and 2 of these are neonatal deaths, which means that they've died within 28 days of their birth. So you can see on the right, there's a graphic that's directly pulled from the Australian Institute of Health and Welfare's website. And it shows you the 2,896 perinatal deaths in 2019. So these are all the babies that died in 2019. As you can see, 75% were stillbirth and 25% were neonatal. So then you see the different ranks of that classification. Another factor that you can consider from this data is that a lot of the women that live in remote areas are more likely to have infant mortality compared to those 75% of women who live in large populated areas. And that's just because of the different types of services that they have close to them and nearby. So that's something to consider, especially for the women in Australia and when they want to have children. Next, we're going to be talking about obesity and food insecurity. So the Australian government, specifically the AIHW, or the Australian Institute of Health and Welfare, like I stated before, they state that obesity and weight concerns have actually risen greatly in the last 20 years. Like in the United States, it's a rising problem globally. They report in Australia that obesity is shown to cause serious medical issues, very similar to the United States. I think it's very global, but specifically they note issues and rising concern with type 2 diabetes, heart disease, and even cancers. In a 2018 study, they found that 1 in 4 children, those children ages 2 to 17, were obese or overweight, and 2 in 3 adults were obese. So this is a 1 in 5 increase over the last 2 decades, which is why a lot of the health officials are concerned in Australia because of this. And they even note on their website many of the factors that could contribute to this pandemic of overweight and obesity. And they said it's likely based on their lifestyle, diet, and level of activity. So basically everything that we say here in the United States, they have a similar issue, just maybe not as severe. And unfortunately, many people worldwide experience this issue. And they also experience issues with securing food for themselves. So in Australia, food insecurity is actually estimated to affect 5% of their population. This could mean 3 things. So they could be unable to access food completely. They could be unable to access food, but sometimes they can. It's just an inconsistent supply of food. Or they're able to access food, but it's not nutritious enough, or it's unsafe to eat. And so people who are unemployed or those people who are in those low income areas are more likely to experience this food insecurity. And on their AIF website, or the Australian Institute and Family Studies website, they had some statistics that I used to create this pie chart on the right side of the screen here. It shows the different percentages of the population that experience food insecurity. So you can see that young people experience 11%, people who rent their homes or who don't own their homes experience 15%, natives of the state or the indigenous people experience 18%, the unemployed experience 17%, single parents 9%, and then low income individuals is almost 29%. So you can just see the different types of people that might be experiencing these issues and who you might want to consider or target when building initiatives within the government to target these issues. Next is chronic diseases. So similar to the United States and similar to any other country, Australia is suffering from chronic diseases with the aging population. And they state that a chronic disease can simply be defined as a long-lasting condition that has continuing effects on an individual. And these conditions are called a disease because they do persist throughout one's life. They don't just get fixed or they don't change very easily. It's a consistent life problem that progresses throughout someone's life with them. And a lot of people who have one chronic condition actually experience or suffer from several. This is what's called multimorbidity. Almost half of Australians actually have at least one chronic condition. So you can imagine how many people actually suffer from multimorbidity. On their government website, the Institute of Health and Welfare, they actually listed 10 chronic condition groups that they report and monitor throughout the years. So I'm just going to list them briefly. It's arthritis, asthma, back pain, cancer, cardiovascular disease, chronic obstructive pulmonary disease, also a heart condition, diabetes, chronic disease, or chronic kidney disease, mental health conditions, and osteoporosis. But they specifically wanted to focus on those that are most common, which are back pain, mental health conditions, and arthritis. So those are the things that are affecting their aging population more heavily, whereas in the United States, it might be, arthritis and asthma, or it might be cancer and cardiovascular disease. And the data regarding this topic is actually self-reported. So it's only based on people who are willingly wanting to tell the government or willingly going to the doctor and having this reported. So there could be a higher number of cases, and this could be skewed data if people aren't reporting exactly how they're feeling or things are going undiagnosed. So just keep that in mind or take it with a grain of salt that at least with chronic conditions, they haven't found a way to accurately pull this data. It's more self-reported. Unfortunately, we do have to talk about death and morbidity. It's kind of the sad part of the presentation. Despite much of the information about chronic diseases being self-reported, this we do know is based on medical records and evidence and claims. So we found that the leading cause of death in Australia is actually a chronic condition that we identified. In 2022, it was cardiovascular disease. And I have a chart here that shows you the difference between men and women and the leading causes of death for each. I will say, though, that heart disease has decreased across the country in Australia since the 1990s, yet it's still the leading cause of death for men and women as a total average. But as you can see here, for men specifically, coronary heart disease was the leading cause of death, and then also dementia, or specifically Alzheimer's. But there's still there's a 5,000 death difference between those two. So you can still see that cardiovascular disease and heart disease is unfortunately the leading cause of death. And you can see that dementia was the leading cause of death for women, but right as the second again was heart disease. So even though there's a difference of 3,000, you can still see why that is the leading cause of death. And this information does vary by age, being that chronic conditions are more prominent for people who are 45 and older. So we've discovered in our research that Australia currently has a life expectancy of 83 years old on average. So about 40 years of your life, you could be in this kind of range where you're experiencing these chronic conditions. So it's important to have programs and comprehensive healthcare to help that aging population, battle this and hopefully push further than the life expectancy. But I will say that this life expectancy is 5 years longer than the United States life expectancy. So they're already doing better than us, but you always want to continue improving, I believe. And then lastly, I just wanted to talk about How's Life 2020. So this is something done by an organization called the OECD. It's actually called Organization for Economic Cooperation and Development. So this is just something that they do every year. It's kind of like Healthy People 2020 that we do here in the United States. But this is where researchers go and kind of get information from people living in different countries, over 45 different countries. It's kind of like a yearly consensus, except they ask questions more about like overall population health, overall patient satisfaction, how people are just living their day-to-day lives. So some of the factors that they analyze are household earnings, employment rate, community and civic engagement, safety, and life satisfaction. So on the right here, I have some data that I pulled. It was actually a great graphic that they have in their report. So you can see that 5% of citizens are not satisfied with their life as it is. They have low life satisfaction. 6% feel that they are alone and they have no one to turn to in times of need. And 12% live in poor or impoverished areas. So I don't have anything to compare this to for the United States, but these seem like relatively low percentages. And this was during the pandemic, or I guess the early year of the pandemic. And so just take that into consideration. But overall, these are some things that they can work on. But I think this is a fantastic report to kind of look at, to compare how different countries are doing in some of these things, especially with safety and civic engagement and some how it is to actually live in each country.
Next, I kind of wanted to discuss the mental health services and issues with mental health in Australia, specifically because in my research, I saw multiple times that mental health reform was being discussed by all forms of government as well as private organizations. So it made me curious. So I went and looked at the mental health as it is. So the patient census for mental health patients is constantly at 100% capacity. And that is not just for mental health patients only, but the hospital censuses also end up being very, very high or at capacity most of the time. There are not enough beds for the psychiatric patients. So some are sent away too early, or some are unable to get a bed or are held for an extended period of time. And so one of the ways that the government is hoping to address this is by adding more beds, and then maybe having some places that are specifically for psychiatric patients that is separate from act like from physical health, just to make sure that those that have psychiatric issues are able to get the care that they need, especially if they're in a mental health crisis. Another issue that I came upon was no community follow-up. So, for example, if I were to check into a hospital with a psychiatric illness or having a mental health crisis, I would be held for the required amount of hours. If I was ready to go home, they deemed that I was able to go home, then I go home and I don't hear from anyone again. And, if I don't have that follow up, there is a higher likelihood that a patient would commit self harm, or that they would go back into that mental health crisis because there's no follow up. So something they're doing to address that is to maybe have the patient's GP or general practitioner physician, similar to our primary care, that would follow up and keep those instances of being seen for a mental health crisis, and continue to follow up with people to decrease the risk of self-harm or suicide. And another thing that they would like to address is the mainstreaming of mental health care. They actually would like to move towards this. So that would be that you don't go to your therapist only for mental health services, or go to a psychiatrist only for mental health services in a separate building, separate facility, under a separate practice name. Instead, you would go to maybe your GP and discuss your mental health with them, or you could go to other like specialties or hospitals and things that everyone's kind of trained to address mental health along with physical health. So that's something that they're trying to move towards, just to make it less of a taboo subject and make people more comfortable discussing their mental health. Finally, there are a lot of issues with training. I know this is similar to the United States, but the people who are psychiatrists now are moving closer to retirement age, but there are not enough people training to be psychiatrists or training to address mental health that are going to be replacing them. So they are having a lack of incoming providers, essentially. And so they're trying to make sure that they're driving enough people to become those psychiatrists so that they have people to care for their future populations.
Before we wrap up, we just wanted to give you a short snapshot into how COVID may have impacted the Australian population. So this data was from 2 days ago, October 21st. It's from the WHO's dashboard. They have that global dashboard, super cool. This is exactly from their website. I just took a snapshot of it. So you can see that they, as of October 21st, had 10,301,894 cases of COVID confirmed in Australia. So not as many as rest of the world. And you can see below that they've had 14,853. Surprisingly, they've actually had 0 new cases reported in the last 7 days within the entire country, which is absolutely absurd to me, because we still know classmates and coworkers and friends who are getting it here every day in the United States. I think when I was looking at the United States snapshot, it was around, couple thousand at least being reported every single day, and they haven't had a single case in 7 days. So it seems that Australia, being that it's an island and they are kind of separated physically from a lot of the other countries in the world, they were able to escape the impacts of COVID a lot, especially within the first wave. It seemed that it had little to no impact on their lives. And it seems to have little to no impact on their overall health, being that there's only 14,000 cases about that have died. In fact, they've only recently started seeing more cases. So you can see it's a lot higher once you reach January 1st of 2022. And you see that big spike. So they've only recently been seeing that. And it's probably because they've been a lot more travel and they're starting to actually have open access and open borders. But I do believe that this really low kind of flat line the last couple years, where we've really had a high up and down in the United States, was because of the strict lockdowns and the high vaccination rates. So we're going to be talking about that next. So as of October 19th, they have a total of 12,814,704,622 vaccines that have been administered. And that's billions more than the United States. And their government actually enforced 2 lockdowns since the start of the pandemic. They were very similar to the United States. They had masking in public. They transitioned to online learning and online working. They had curfews and they closed non-essential services like retail and manufacturing. They did these for 6-week periods. And of course, they limited travel in and out of the country. That's basically the first thing that everyone did when the pandemic started. And I think that despite the lockdowns being difficult to get through, I mean, 6 weeks completely at home almost is hard. It did prove effective for them to limit the spread of the virus without jeopardizing the health of the entire country. And that shows in the data. So just to wrap up, we wanted to show just a brief glimpse of some of the strengths and weaknesses that we've discussed. So some of the strengths, like we said, every citizen has some form of insurance. That's amazing that there's nobody that has no insurance. So the unemployed rate is 0, which is fantastic compared to the United States. And we noticed that there's an improved sense of security for citizens, knowing that they have that insurance, knowing that they have some sort of coverage, and an improved sense of satisfaction and overall happiness. And then we found that some of the weaknesses were, like Emma was talking about, people need extra services that they might not have access to, that they'd have to find supplemental insurance to cover for. So even though universal insurance is good, it doesn't catch all. And we know that. And then lastly, mental health services need reform in Australia, and a lot of the countries around the world, but specifically they've been struggling with it. And lastly, we just have our references.
Thank you